Still have 2 minutes. Okay, I think it's the time to start. Good morning, good afternoon, and good evening. I am Asma Smadi from the National Erasmus Plus office in Jordan. I'm privileged to host this session today, along with my colleague from the National Erasmus office in Lebanon, Ms. Yasmin Gharib. In this session, we will be able to learn more about 3 projects in the health field. And before we start, let me first draw your attention for some technicals for the participants. You have a caption button under our videos. You can use it. You can see in the right hand of you a question and answer section. You can but please, before you ask the question, please specify to whom or to which project you are directing the question to, and you can vote also for the question in case you have the same question with the others.
Asma?
Yes. Hello. Can you hear me?
Okay, can you hear me? The other
Yes.
speakers?
Yes.
Yes. Okay.
Okay. So apparently Asma has lost her connection. So this is just to draw your attention to some of the housekeeping issues. So please, you have on the right side on your screen, as you can see, the chat button where you can talk to the group. Next to the chat, you have the Q&A where you can post your questions. And please, if you have any question, just post it on this Q&A tab, for it is easy for us to process these questions. Okay. So please.
Okay. Now we will start. Can you hear me? Please
Yes.
confirm.
I can hear you.
Now we will start with the first project entitled MPENSA, which aims at improving early nutrition and health in South Africa. Please allow me to welcome Professor Lisa Havmanel
The
from
project
Northwest
MPENSA.
University in South
So
Africa,
please.
and Miss Kerry Sexton from University of Cape Town, also in South Africa. Please, the stage is yours.
Thank you very much for the opportunity to showcase our MPENSA project. So in this session, we are going to reflect on the development of an innovative blended training program to support healthcare professionals working in early life nutrition. We are going to give a brief introduction to MPENSA, We're going to discuss the development steps of a blended training program. We're going to point out the challenges encountered from COVID-19. We're going to share our adjusted plan following the pandemic. We're also going to touch on M-Pensa capacity building, impact of M-Pensa in South Africa, and also discuss the next steps to ensure sustainability. So the M-Pensa project is a capacity building project to improve early nutrition and health in South Africa. So on the left, you can see that this multinational and multidisciplinary consortium consists of 6 higher education institutions, 3 from South Africa and 3 from Europe, including 2 health professional associations. The M-Pensa mission is to address the triple burden of malnutrition that South African communities face, and that includes undernutrition, overnutrition and obesity, but also micronutrient deficiencies. The M-Pensa aim is to facilitate continued professional development and strengthen relations between the higher education and the wider economic and social environment through the development of an innovative, evidence-based, blended learning program for healthcare professionals with focus on the micronutrient nutrition specifically during the first 1,000 days. So the development of a blended training program requires a number of steps or phases, starting with a preparation phase to get a good sense of the current training landscape, as well as the training needs and challenges of healthcare professionals. Then the second stage is, of course, the development that includes development and design for local context. And then the third main phase is to evaluate the effectiveness of this training program for local context. So these phases were organized in different work packages that were executed by different task teams, each with a unique strength and expertise at different time points during the project lifetime. So the development phase per se consisted of 3 work packages, and the development of the content specifically required expertise in nutrition, behavior change, and psychology, since the aim of the training program is to equip healthcare professionals with skills and knowledge to support women and mothers with babies to improve their children's micronutrient nutrition per se. So the South African partners in particular provided the health and nutrition expertise and ensured that the content is relevant to the South African context. Then our European partners in expertise specifically in learning design and Moodle implementation led the second development phase, and then experts in education and behavior change communication, in particular from the University of Southampton, trained the coordinators in the third development phase to then deliver this training package. So if we zoom in a little bit on the e-learning module design and development process, with inputs from the first work package that formed part of the preparation phase, we developed the module descriptor, then wrote the content of the modules, followed by instructional design and media development, and finally implementation on the Moodle platform. Quality control was ensured by both internal and external review at all these steps. However, before we could start the development, decisions on target users, topics, learning outcomes, time allocation, and mode of delivery had to be taken. And this was also informed from input from the first work package. Then additional considerations was pre-existing knowledge and the education level of the healthcare practitioners, the South African context and relevance, national and global guidelines and policies, existing tools and educational material, and of course, the scientific literature when developing the training content. So based on findings from work package 1 or the preparation phase, in particular input from focus group discussions that explore the training needs and challenges of healthcare professionals, a blended training program was developed that included 2 self-directed e-learning modules, as well as 1 facilitated module. So the e-learning modules was specifically developed for the theoretical or knowledge components, and the facilitated module was developed for more skills-based components. So on the left, you can see we developed a knowledge-based optimization of micronutrient nutrition during the first 1,000 days module, and a second module on communication to support behavior. And module 2 especially served as the base for the facilitated skills-based healthy conversation skills to support healthy behavior change. And this module consists of 2 4-hour facilitated sessions that are being facilitated by a healthy conversation skills coordinator. So together, these 3 modules then form the Impensa training program. And as I mentioned earlier, and Kerry will expand on that a little bit later, the third development phase was then to train the coordinators to deliver and facilitate this training program. I would also just like to use this opportunity to share with you some of the e-learning module components that was included in the e-learning modules. And these were developed also based on the needs and challenges and expressed by the healthcare professionals during the focus group discussions. So they wanted evidence-based text content with practical recommendations. They wanted guidelines that are based on national and international guidelines. For instance, in South Africa, each new mom receives a Road to Health booklet that already contain practical messages, for instance, on breastfeeding and complementary feeding. So we ensure that the content of these modules, of course, are in line with the existing national and international guidelines. The participants wanted to interact with the content, and that's why we developed interactive media. We also included a number of in-lesson activities for the purposes of self-assessment. We've included scenario-based videos with practical simulations, and we've also included animated videos with contextualized examples. So from these examples, you can really see that the components are visually stimulated, they're interactive, and they are based on practice. So I'm now going to hand over to my colleague, Ms. Kerry Sexton, who will tell you a little bit more about the Trainer Coordinator program, as well as how we adjusted this program to the challenges of COVID-19. Thank you, Kerry.
Thank you, Lisa, and hello, everybody. So in the final development phase of the project, the Impensa Consortium selected 4 coordinators from South Africa to undergo a Train the Coordinator mentoring program to eventually enable them to facilitate delivery of Module 3 or Healthy Conversation skills to healthcare professionals. So these coordinators undertook the first 3 modules as discussed by Lisa, and then a 4th module or mentoring program, which consisted of several mentoring and coaching sessions to enable them to develop the skills to deliver healthy conversation skills. So we've just completed this phase of the project, and the next phase then is the pilot of the training program, where these newly trained coordinators will go on to deliver Module 3 or Healthy Conversation skills. So COVID did indeed introduce some challenges. So notably adapting to working and communicating in a virtual capacity, which often slowed things down. Module 3, our Healthy Conversation Skills module, and Module 4, the Trainer Coordinator Mentoring Program, were originally envisaged as face-to-face sessions, which were scheduled to take place earlier this year, where our colleague, consortium partner, and Healthy Conversation Skills expert from the University of Southampton, Professor Wendy Lawrence, was actually due to travel to South Africa to facilitate the delivery of these modules. And when it was clear that COVID wasn't going away and we remained in lockdown down here, both of these modules had to be reworked as virtual offerings. And this has then meant that the implementation of our training program has been delayed by several months. So the 2 4-hour face-to-face Module 3 or Healthy Conversation Skills sessions are now 2 4-hour virtual interactive sessions conducted via Zoom, using functions such as the breakout rooms and annotate to maintain the interactive component to ensure that participants remain actively engaged throughout the sessions. And on the right of the slide are some screenshots of Professor Lawrence, our Healthy Conversation Skills Super Trainer, delivering session 1 of Module 3 via Zoom. And in the second slide there, you can see where participants have annotated a particular slide that she was delivering. So the pandemic also meant that the coordinator mentoring program, or Module 4, also moved online, with the mentoring and coaching sessions facilitated by Professor Lawrence now hosted virtually and very effectively, it has to be said, via Zoom as well. We also included an extra tech session on how to use Zoom for interactive virtual sessions. And after these sessions, the newly trained coordinators then conducted supervised delivery of virtual healthy conversation skill sessions to healthcare providers to hone the skills that they just learned via the mentoring program. So we're due to start the pilot of the training program with our newly trained coordinators this week. So the coordinators will deliver a virtual Module 3 or healthy conversation skills to about 8 to 12 healthcare professionals after these participants conclude online modules 1 and 2. And as part of the adjusted pandemic plan, the evaluation component of the pilot, which originally also consisted of some face-to-face elements such as interviews, also now moves online. So our project has indeed facilitated and will continue to promote capacity building on many levels. So firstly, this includes the transfer of skills, both to consortium partners and within consortium partners and to healthcare professionals in South Africa. We're also establishing infrastructure in South Africa for effective and efficient generation and delivery of a blended training program and strengthening counselling skills, which are much needed for healthcare providers here. We're providing an effective CPD digital training course based on evidence of knowledge and counselling skills in nutrition and lifestyle in early life. And this is quite unique in current CPD program offerings in our country. We're also fostering South African higher education institutions' position as qualification providers for healthcare professionals. And ultimately, we intend to strengthen relations between higher education and then the wider economic and social environment. So in terms of the impact of our project, our training program has been accredited for 15 CEU or CPD points, which is half the points required currently by South African healthcare providers per year. And we are also currently in discussion with representatives of our Department of Health, especially down here in the Western Cape, to ensure sustainability of the Impenza training program. And this includes formalizing and integrating the program within healthcare professional training here and other provincial First 1,000 Days initiatives. So we're currently busy with our next steps, which include the development of a business model to ensure sustainability and to continue to build capacity among South African partners. We will be rolling out the training program after the project end, where we'll create a training facility or hub at Northwest University. We're engaging in discussions with various stakeholders to generate income to sustain training program delivery after project lifetime. And we'll be embedding the training course into existing programs and qualifications. And whilst doing this, maintaining then the e-learning modules on the Moodle platform and revising these and reaccrediting them as and when necessary. And then finally, this is a picture of our Impenza team and consortium at our last biannual face-to-face meeting, which took place almost 2 years ago, just pre-COVID, in Cape Town. And we're hoping to recreate this very picture in April next year with the official launch of the Impenza training program in Cape Town, COVID permitting, of course. So that brings us to the end of our presentation, and we thank you very much for joining us today.
Okay, thank you, Liz and Kerry, for your efforts in this program. Now we will move to our second project, which entitled Just CRS. This project has succeeded to establish the first interdisciplinary clinical rehabilitation science master in Jordan and in the region. Please let us invite to the stage Professor Muhammad Nazal from Jordan University of Science and Technology and the project coordinator, and Professor Antonio Lopez from Portugal. Please, the stage is yours.
Assalamu alaikum. Thank you for the organization of this event, and thank you for attending our presentation about our project, the Interdisciplinary of Clinical Master Program in Rehabilitation Sciences Master Program. This is Muhammad Nazal from Jordan, and my colleague, Professor Antonio from the Al-Khattaw School of Health Sciences in Portugal. And we have to acknowledge the incredible working group of staff from all project partners. So in this project, our collective effort was to reform the rehabilitation sciences higher education in Jordan through the establishment of a master program, an interdisciplinary program in rehabilitation sciences at JUST. And we saw a gap in how a rehabilitation sciences higher education program is running in Jordan, and we proposed a solution, an interdisciplinary master linking academia, clinical practice, research, with the help of a consortium which will help us in benchmarking to certain quality and help our market, labor market needs in Jordan as well. We wanted this program, this work to have an interdisciplinary flavor. We needed to focus on and infuse evidence-based clinical rehabilitation practice, improve our teaching capacity, and utilize an online clinical education platform, and more importantly, build an international network of experts in the field. In order to do that, we built a consortium to help with this endeavor, lots of expertise. Jordan University of Science and Technology as the grant holder, together with OBU, Oxford Brookes University from UK, Hacettepe University from Turkey, Al-Khattaw School of Health Sciences in Portugal, and two other universities in Jordan, University of Jordan and the Hashemite University. So our project ran from October 2016 till April 2020. And in this presentation, we will focus on the preparation and development work packages, which contribute to the main outcomes and impact of our work. So the needs assessment, the interdisciplinary curriculum, the teaching laboratories, clinical and teaching capacity, the online system platform, and the actual implementation of our work. So in order to do that, consortium has met several times and worked diligently and collaboratively, bringing all expertise together, such as quality of higher education, clinical rehabilitation pedagogies, and online education, just to name a few. So what had been done? We conducted a national rehabilitation analysis that provided us with the base of what reform we needed to implement and what graduate competencies we needed to focus on. And based on that, we set up a whole curriculum from scratch, building our customized competencies and modules objectives, individual modules objectives for our Jordanian students. We built 25 courses, modules, completed in this master. Our program was approved by the highest council in Jordan. It was also built and based on both Jordan and Bologna European standards. It was later also checked out by an independent curriculum evaluator for quality assurance purposes. We were all thrilled that our work has created the first master program of its kind, actually, in Jordan and the Arab world. Program first launched in October 2017 with 18 students. So far, we had 5 cohorts, so one cohort, one group each year. The actual implementation of the master program was conducted collaboratively among staff and all consortium partners. This was applicable to all activities, such as implementing the different teaching pedagogies, clinical training in Europe, and thesis. So even thesis supervision was done collaboratively, where some cases, like 3 to 4 different partners sit on the thesis defense committees. So a number of mobilities were arranged so students would have this hands-on and face-to-face interactive discussion with their professors from Europe and from Jordan. And students of the first 2 cohorts had completed their clinical training in Europe 2 months. So now I would like to welcome my colleague, Professor Antonio from the Al-Khattaw School of Health Sciences.
Hello, I would like also to give my contribution to this presentation. So in the means to implementation, a workshop in Lisbon was held to brainstorm what kind of technology, methodology, and what kind of assessment methods would fit the different models of and objectives. And to support this collaborative approach to teaching, we use an online platform, and based on the needs assessment, Moodle was the system that was selected. We set up the system and conducted training for both Jordanian and European staff. Staff and the students' feedback about the use of the system was overall satisfactory. We also use this platform to archive lectures and also course content. A similar system was used after this by 13 MOOC courses in different rehabilitation topics for the community of therapists in Jordan and Arab world. At this moment, we have more than 3,000 attendees who complete these MOOC courses so far. Next. In relation to the laboratories, they were designed to support the overall teaching and the master program and were based on the necessities of the curriculum and its different modules. After establishing the list of equipment needed, procurement took most of the time, but after the installation, training was provided for both staff and students. We are happy with the fact that this lab are equipped with some high-tech equipment like some of the most advanced rehabilitation labs around the world. Next. This, next slide, please.
Sorry.
These are some of the scientific outputs of the program, mainly students' work and publication in international journals. Some of the students also present their studies results in local international conference. Current students are working in more complex topics using the technology and lab equipment already available, such as gait analysis. Next slide, please. During this project, we also implement a teacher training program aiming to increase clinical and academic competence of the Jordanian staff. To achieve this, needs were identified and customized training workshops were conducted in European partner countries, in which 30 Jordanian staff participate. The staff then were asked to deliver similar training back in Jordan, which was done at first face-to-face, but then due to COVID, online webinars were established and used, and at this moment, more than 1,000 Jordanian staff and students received the training back. These are some of the examples of the teacher training program that were performed in the 3 European sites, such OBU UK, ESSA Portugal, and ASETEP in Turkey. And this is also some examples of the online webinars that were delivered in Jordan. Now I pass to my colleague again.
So as for the sustainability, Just CRS is continuing to attract new cohorts from inside and outside Jordan as well. And thanks to the well thought of curriculum, which is based on scientific methodology and the state-of-the-art CRS laboratories. We also noticed the CRS alumni increased employability. Many of our graduates had accepted advanced clinical or management, research, or academic positions in different higher education institutions in Jordan and the Arab world. To my knowledge, 8 of our alumni are now adjunct lecturers in these universities. Memorandum of understandings with local universities and European universities have been signed to ensure continued collaboration and ongoing talks about future projects such as capacity building projects and international credit mobilities as well. It was not an easy task. Our consortium believed in one goal and idea of the project. Yet, yes, we have different cultures, systems, and languages, but we also have a genuine interest to work out our differences and problems. It was an amazing feeling to know that we made a difference, a positive impact in the lives of students who graduated from this program. It was not an easy task, as I said. For example, curriculum was built in a relatively short period. Also, it was somehow a difficult accreditation process. We thought at times we couldn't make it, but thanks God, and in many other international projects, travel, visa, and training arrangements can be little bit problematic. We thank the consortium partners for their dedication and commitment to the project objectives. And on behalf of our students, staff, and all the members of the consortium, we would like to thank IKEA, represented by our project officer, Mr. Kasali, and our amazing NEO director in Jordan, Professor Abu Al-Haija, for their incredible support and assistance. Your help actually and feedback and suggestions made sure that we have a successful implementation of the project. These are some good links to follow if you would like to learn more about what we did, the contacts of our consortium partners if you would like to collaborate on some innovative projects in the future. We actually extend our hands for more partners to expand our network. Now, Ms. Asma, if you can show the video.
The Clinical Rehabilitation Sciences Master Program, known as just CRS, is a funded project supported by the Erasmus Plus program of the European Union. Thanks to the Erasmus Plus Generous Fund, 2 rehabilitation laboratories for movement sciences and neurodevelopmental rehabilitation have been equipped in Just University with the vision to be the center of excellence in clinical rehabilitation training in Jordan. The 2 labs contain unique and high-quality specialized equipment, such as the optical motion capture system from Vicon, isokinetic system from Biodex, gait map from Xeno Walkway, the electromyography 16-channel system from Noraxon, to name a few. These laboratories were intended to provide the CRS master students with the most up-to-date equipment needed for their study modules and clinical courses, as well as the research courses and thesis work.
It has been a great, one of the best projects I've been involved so far in the international context. It was a real co-creation among 3 main different cultures, and that was the challenge, coming together into a same understanding of concepts, into the same understanding of goals, and especially to the understanding of the needs in Jordan for a master in clinical rehabilitation sciences.
Had the chance to exchange our experiences in teaching physical therapy and occupational therapy between European countries and Jordan. We learned a lot from this program, and it was a seed actually program in Jordan to develop other graduate degrees in physical therapy and occupational therapy. So thank you so much.
I worked in development of curriculum It was a very exciting project, and we worked hard, and we changed our experiences during the project. It was a very challenging process, but we have learned from each other.
I think we've seen during the programme some fantastic students who've come to the UK, and I'm sure come to other countries, who are now graduating from their programme, which is really exciting.
I had my training in Portugal.
Sorry, I had to stop the video here. We will share it, of course, of all audience through the capacity building virtual fair records. Now, we will move to Accord project, which introduces innovation and digital pedagogy methods in healthcare and in biomedical sciences. It seemed very interesting project. And to know more about this project, please welcome with me Dr. Frida Idris and Professor Sazlina Sharif Ghazali from University Bautra, Malaysia. The floor is yours.
Okay, thank you, Ms. Asma. Good morning, good afternoon, or good evening. It's 6:30 p.m. in Malaysia today. So today, me and my colleague will be sharing of our project. Because of the interest of time, we have pre-recorded our presentation, but rest assured that we are here live for question and answer after this. So in the meantime, you all can see our presentation. Thank you.
Assalamualaikum warahmatullahi wabarakatuh, and good day to all participants in this session. My name is Farida Idris, and today my colleague Sazlina and I from University Putra Malaysia will be sharing about our Erasmus Plus project called Accord, which stands for Advancing Co-Creation of RLOs to Digitalize Healthcare Curricula. This project is led by University of Nottingham, UK, with University of Stavanger and Karolinska Institute, are our EU university partners. And together with us from Malaysia are University Malaya and Taylor's University. This project aims to develop multimedia digital tools and resources called reusable learning objects, or RLOs, and integrate them into the traditional curricula in biomedical and health sciences, thus contributing to capacity building of Malaysian higher education institution. The main objective of this project is to introduce the digital pedagogy methods, train the trainers, and create new RLOs using the Aspire methodology for biomedical and health sciences. RLOs are usually small in size, 5 to 15 minutes each, which focus on a single learning goal, and it uses a mix of media and usually have sequences of pages, and each RLOs is standalone and interactive, and most of the time RLOs are led by the communities. In Aspire methodology, A stands for aim. In this project, we use Delphi survey to identify the needs and the topic areas before decide which topics to be converted into RLOs. As a storyboard in which users and stakeholders will co-create storyboard of the topics to ensure alignment with the learning needs of the learners. P is to populate, in which specification of the storyboard of a particular RLO will be done and will be undergoing multiple review processes. I stands for implement, in which RLOs are implemented as HTML5 web pages and responsive to different devices. R is the release part, in which after extensive review session, RLOs was hosted on an online repository which can be accessed anytime and anywhere by the learners. So for the needs analysis, in which we use the Delphi survey, and based on the expert review, we have selected topics in the existing curriculum, and then we created a survey and disseminated it to both educators and learners to prioritize the RLO topics. We did 2 rounds of survey, And for each partner university in Malaysia, they will analyze and after that come up and identify with which topics for the RLO development. So after we have identified the topics, then each partner university will organize storyboard workshop for the selected topics, involving both the educators and the learners. And each partner university organize few such workshops according the RLO's topic. And at the end of the workshops, we will have few storyboards for the RLO topics. For Malaysia partner universities, UM selected topics in primary care medicine, while UPM selected topics from personal and professional development module. And for Taylor's University, they chose anatomy, physiology, biochemistry, and community practice topics to be converted into RLOs. These RLOs are used as a supplement to the existing teaching activities using blended learning approach. To date, we have 23 reusable learning objects of various health-related topics ready to be used, and we have parked them in our online repository at ecod.my. Everybody from around the world can visit this website and can use the RLOs at any time convenient to them. So for University Malaya, few topics that have been converted into RLOs include prescription, writing back to basic, treatment plan for acute illness, and also principle of family medicine. For UPM, few topics in the PPD module include confidentiality, ethical reasoning, consent, social media, professionalism, among others. For Taylor's University, they have completed RLOs for DNA repair, DNA replication, and also body metabolism, among others RLOs. So these are few examples of the interface of our RLOs. So when they go into the RLOs, they will go into this interface. And when the users click the content, they can see the whole content of that particular RLOs, and learners can easily navigate each page using the different tabs available and can also listen to the narration of the particular RLOs.
Assalamualaikum and good day everyone. Thank you Farida. Hi, I'm Sazlina. Next, I'll be sharing with you on the impact of the RLOs. The ACCORD project has started in November 2018, which is a capacity building project to develop reusable learning objects for tertiary education curricula in 3 universities in Malaysia, which is University of Malaya, University Putra Malaysia, and Taylor's University. So we have conducted a study which was aimed to evaluate the RLO's impact on users' reaction and satisfaction, as well as their learning. The evaluation of the RLOs was guided by Kirkpatrick's model, focusing on reaction and learning by measuring if the learners enjoyed the training and if learning transfers occurs. In addition, we also evaluated the impact of RLOs on its reach and uptake and capacity building and expansion. Before the students use the RLO, we asked them to answer the learning questionnaire. This questionnaire has questions on knowledge and confidence, which was set according to each RLO topic. Following that, we invite the students to use the RLO, which has about 6 to 10 pages of main content, which depends on the topic. Immediately after using the RLO, we invite the students again to answer the learning questionnaire as well as the reaction questionnaire. The reaction questionnaire has information on usefulness and user-friendliness, as well as open-ended reaction comments. Later, at 6 weeks post-use of the RLO, we invite the students again to answer the learning questionnaire. For the learning questionnaire, we looked at the knowledge score and confidence level at different time points, and these were compared using inferential statistics. As for the reaction questionnaire, we analyzed descriptively and thematically. We also looked at the dissemination of our RLOs using the Google Analytics. We specifically measure number of users with the demography and pattern of use. A total of 431 students from University of Malaya, 398 students from University Putra Malaysia, and 364 students from Taylor's University participated in our study. The students have generally positive reaction towards the RLOs due to its simplicity, ease of usage, and interactivity in all these three universities. The measurement of learners' performance showed significant improvement in the test assessments before and after implementation of the RLOs. The retention of knowledge acquired was also demonstrated at 6 weeks after the use of the RLO, suggesting that it is helpful in supporting the attainment of learning outcomes. Past studies have reported that RLOs improve knowledge. Our study shared similar findings besides adding to the body of evidence about knowledge retention after using the RLO. The level of confidence also improved before and after the implementation of the RLOs. It is also observed at the 6 weeks post-exposure to the RLO. Hence, RLOs are effective in improving knowledge and confidence immediately and over time with good user experience. However, we would like to share that our sample are low. RLOs implementation occurred at different stages, and there was some difficulty in follow-up at 6 weeks. To begin with, some of our baseline score of the knowledge is quite high, which has difficulty to show the difference. We also recommend that future studies should consider evaluating Kirkpatrick's behavior and results. In terms of our RLO, it has reached users from other countries outside of Malaysia based on our Google Analytics. Among these countries included the North America, United Kingdom, Singapore, as well as China, as well as other countries. Over the period of 2.5 years, we have trained a number of RLO stakeholders in the development and utilization of RLOs that included undergraduate students, academicians, administrators, and non-higher education institution personnel. During this ACORD project, we have not just developed RLOs for the academic use in the university curricula, but we also brought the RLOs to the community, targeting use by the patients and community at large. An example in UPM, we are developing the RLOs with the family physicians, exercise prescribers, dietitians, and clinical psychologists on weight management and fitness. We also included the patient in the development of these RLOs. Our partner in University of Malaya have also developed RLO with the SingHealth Polyclinic Singapore on patient decision aid on insulin. We have also moved the RLO from the health disciplines to other disciplines as well as done by our partners from the Taylor's University. So in conclusion, our preliminary data showed that the RLOs are effective in improving knowledge and confidence immediately and over time. Users' feedback showed good user experience. These RLOs should be disseminated to a wider context once the evaluation phase is complete, and more RLOs of various topics can be considered to be developed in the future. This is our research team from ACORD. Thank you for your kind attention, and terima kasih.
Thank you for your efforts. Actually, it's well done. Now we will have the question and answer, and we will have the opportunity to answer some questions. The first one is for Professor Liz, I think. She was asking about the eligibility period of your project and how have you done the dissemination and exploitation for your projects.
Thank you. So the original project lifetime was meant to be 3 years from 2018, January 2018 to January 2021. However, we applied for a 1 year extension as a result of COVID, and we were recently granted another year extension. So this project will end in January 2023. And in terms of how we done the dissemination and exploitation for the project, so we do have an Impensa website and a Twitter account, and we try to be active on social media whenever we can. We also circulate a newsletter every 6 months to stakeholder groups and target users. We've presented our project results at a number of conferences. We've also hosted 1 or 2 webinars, again, where we specifically invited stakeholders. We've also published 1 or 2 informal publications. For instance, we've just submitted an article to News 24, and then we've also have a number of publications that we've prepared for publication in formal journals.
Okay, thank you. Now to our question. It's for, I think, Professor Muhammad Nazal. I'm wondering if there was any discussion to include PSS and mental health as a part of the subject, and if not, why not?
Thank you for the question. So we wanted to focus on rehabilitation sciences that can be jointly implemented by occupational therapists and physical therapists. And actually, we left it, we were open to any direction from the needs assessment. So the needs assessment geared us towards the to create a master program that focuses first on orthopedic and urological tracks in this master. But some modules were focusing on the biopsychosocial aspects of illness and rehabilitation. So it's a comprehensive master with lots of with 7 graduate competencies, and some of these competencies about being a good, an excellent rehabilitation therapist, researcher, community developer, and community advocate, and research and management. And biopsychosocial and mental health were part of these modules.
Okay, thank you, Professor Muhammad Nazal. Our next question is to Professor Sazlina. Regards to commuting contents to online format, how much can content be pulled across universities in the same health system and beyond? That how much can contents be pulled across countries even with the necessary adaptations?
Hi, thank you, Eda. Hi. Actually, the content is there's of course certain copyrights issue there, but the one that we have uploaded in the Accord repository is actually available for use by anywhere across the world. So it's actually for free. And people can use it in terms of its contents, because we tried to make it as generic as possible, not so much of a culture bound as well. Yeah, but in terms of the adaptations, definitely it requires permission. And I think with us today is also our project leader, Professor Heather. Okay, perhaps there's a platform that you can actually request through the Accord project, which you can visit our Accord website, which is accordproject.eu. That's where you can reach us. Thank you.
Okay, thank you, Professor Sazlina. And we will back to another unanswered question about, I think it's for the Jordanian colleague, Dr. Mohammed Nazdal, how to join one of the training programs for postgraduates. Dr. Sarah Muhammad, I think she is asking about the clinical rehabilitation master
Yeah,
program.
so how to join one of the training programs. So in our presentation, I'm not sure if you're talking about the master program or the products, the outcomes from this whole project. So yeah, if any therapist who graduate with a bachelor degree in occupational therapy, physical therapy can join our master program. But if you are referring to the MOOC courses, so we have a platform. It's open.just.edu.jo. So it's a Maharat platform. It's skills platform. It's called Maharat. So open.just.edu.jo. You can browse the different MOOC courses for rehabilitation sciences topics, such as pain, shoulder pain, management of neck and cervical management, and lumbar management, sleep. So all these topics are provided for free in this platform.
Okay. Just to remind you that there is a lounge outside this session, and you can meet bilaterally to discuss more about anything you need to know about the project that was showcasing in this session. And also you can we have also 40 thematic table that you can enter and discuss anything. Okay, I think there's no more questions on the chat, but I have a question for Impensa project. If you have any chance to improve or change anything in the project, what it will be and why?
Thank you, Asma. I think we would still like to get our coordinators trained to also deliver face-to-face healthy conversation skills. So we had to adapt our training and we now trained to deliver virtual healthy conversation skills, which work really well. But we do have target groups in South Africa that may not have access to computers and internet connection. So we would still like to be able to do face-to-face training and take the training to the rural areas and the areas that may not have the necessary internet connection. I don't know if my colleague Kerry wants to add something, but I think that's what in my opinion, what we would do, yes.
I'm not going to add anything, Lisa, because I would have said exactly the same thing, is to have that as the next phase. Yeah.
Okay, I hope you can do so in the next year. And I want to ask also Dr. Antonio from Portugal. What lessons or what the main things you have learned from this partnership with the different culture, with different education system? What was the benefits, or what this project impacted you as individual and at institution level?
Personal, at least at personal level, humility, because when has the group of European partners joined to help Jordan partners build up a new education process, we started with the already preconceived notion what should be this product or this final output of the project. And with interaction, with knowing better the Jordan context and knowing better our partners and their needs, we were able to transform our preconceived idea about what should be this output to a more customized approach and more collaborative and co-creation approach to developing these kind of projects. And it was very enticing, very rich at personal and also at the educational level. Other thing that we learn within this project is sometimes time is needed to establish all the steps, because we start with a very big idea in the beginning how to implement this project, but we learn so much things that along the way we have to make so much adjustments and changes, and we have to collaborate as close as possible with the partners, that in the end the final product, even though it can be different for what we envisioned at the beginning, it will be for sure richer. So this is my deepest thoughts and ideas about joining this kind of projects.
Okay, thank you. And I think it's the time to end our session now. I would like to thank all the participants for being with us and being engaged for a whole an hour. And I want to also thank our speakers from Malaysia, from South Africa, from Jordan, and from Portugal. Thank you all. Hope to see you in other sessions. And bye. Have a nice evening. Bye.
Thank you very much. Bye-bye.
Thank you.
Bye, everybody.
Bye. Bye. Thank you.
Bye.
Thank you.